It's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
My name is Glied, and from 2010 to 2012, I was the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services in the Obama administration. There's two things about the healthcare system that people don't appreciate enough. One of them is how extremely concentrated healthcare costs are. If I take any random group of 100 people, the 100 people you work with, the 100 people you go to school with, one of those people in any given year is going to account for 25% of the cost of the whole group. Half of those people are going to account for 3% of the cost of the whole group. If you're an insurance company and you can insure the half that's only going to cost 3%, you're doing a lot better than the insurance company that just happens to be unlucky enough to get that one person who turns out to be sick. That makes healthcare really hard to deal with because it's like playing hot potato. Who's going to be stuck with the person who's really sick at the end of the day? And there's a lot of waste in the system that consists of just moving that person around. So that's one thing I wish people understood. The second thing I wish people understood is that the reason healthcare costs get higher and higher every year, and this is different from why U.S. healthcare costs are higher than other countries, this is a problem that's true everywhere in the world, is that we are able to do so much more for people than we were able to in the past. People are living longer lives, they're on the whole living healthier lives. We see older people playing tennis. We see all kinds of extraordinary innovations in healthcare. People with hepatitis C who had a death sentence just 5 or 8 years ago and now can just finish their drugs and walk away with it. People surviving cancer. That all costs an awful lot of money, and it's money we didn't have to spend 50 years ago because we didn't know how to do any of those things, and those people just died or suffered. So we get a lot for our dollar, and that's part of what makes this so hard too. We're taking away something that's really valuable and important to people.